e poi ti vado a chiamare Fabio.
Okay, start again.
Thank you.
Okay,
Sorry.
Mama is still here. This is a 6-year-old boy, and he was staying with his grandma. And he was doing fine, but he suddenly became very, very sleepy. And he was acting kind of crazy. And so his mother didn't know what to do. She brought him in the car, and she brought him right here. Okay? And so now he's here, and he's just combative. He doesn't want you to touch him. He's not making sense. And he looks pale.
Okay.
Start, please.
We have a 6-year-old boy, 20 kilograms. He's
Marco, calm down. It's okay. It's okay.
Okay, he's conscious.
Stop fighting.
He's not recognizing his mother. He's fighting you, and he'll try to put anything on him. And he's very confused.
And you can maybe sit him in the bed, but we can just and leave the mom behind him. And how is he breathing?
He's breathing a little bit fast, but very comfortably.
So for now, maybe Simone, you can just put near him some oxygen, free oxygen, okay, but not with the mask, okay?
His mother suggests that he looks a little bit red and flushed.
He's so sweaty. He's very sweaty.
Okay.
He's sweating a lot.
Okay, so please Vanessa put the parameter. Then Simone, can you look at here the airways?
Okay.
He has a lot of secretions.
Secretions?
Oh, sorry. His mouth is very dry. His mouth is very dry.
Very dry.
But his airway seems to be open. He's moving around. And he's not liking it when you're putting anything on him.
Okay, can you just check the chest rapidly, please, Simone?
Okay.
Yes, if you want to try and look for an EV line, maybe for now. Okay. Okay. Then.
Just clear.
Good job.
Okay, it's okay. And then we're gonna go on with circulation.
Pulses are good. I can feel it.
Okay.
Very far, maybe a little bit weak. How is refill time?
Refill time.
He's so red. He's really
So
red.
it's really dropping.
3 seconds.
So, we have EQG that with some expressions.
Okay.
He's still moving around. He's still moving around. He's still moving around and combative.
Central pulse very
Here, please
very present.
put the pads for now.
Okay, so do I have daily line?
Yes, you got an idea.
Okay, so the cardiologist because we had in a patient is considered so now the victim I did extra
The mother has received a call that the baby the child took a lot of pills.
Okay. The father told me yes, to go on.
Yes, I don't know, but he has diabetes.
How's pressure?
He has high blood pressure. Do you know why he has
Central pulse is still present.
Okay.
Sinus tachycardia is too long in ET.
Intoxication. Listen to me, please. It's an intoxication. He's dry. He's hyperthermic probably. Yes, he has 38. He took pills. I would wondering if it is an anticholinergic.
Janice?
He's shaking.
Janice?
He's shaking.
Janice?
What's wrong with it? He's shaking. And because of the cardiac problem, there was also sodium bicarbonate, 1 million equivalent per kilogram.
He's starting to move rhythmically, and his eyes are deviated, and he's starting to have more secretions.
Okay, please, Simone, put oxygen.
Okay, is it ready?
Okay, yes.
I'll try to put
And try to, with something, remove the secretion, but don't go deeper with
I won't go deep.
Okay.
Carolina, I'm administered 2 milligrams
Here's the
of
secretions.
lorazepam.
Okay. Then Benedetta, please do electrolytes, point of care,
Yes.
blood glucose, and hemogas, please.
Yes.
Okay.
Shall I put on some cooling blankets for the hyperthermia?
Those are sent to the lab.
Okay, so guys.
Okay, I put on cooling blankets.
Glycemia is normal at the bedside.
Okay.
120.
Okay, we have to remove all the clothes.
Carolina, now saturation is 87, so it's going
Okay,
down.
if you manage to do it, please start a ventilation with 100% oxygen with a flow inflating balloon.
Does he have mosques? Can I try a mayo?
No, he's conscious.
Conscious.
He's still, he's not conscious now because he's seizing actively.
But does he have a morsus?
Does he have what?
Yes,
He's kind of very tight.
I'll try to ventilate.
So guys, okay, he's shaking. We use a millimeter lorazepam. After 3 minutes, you can repeat, okay? And then we have to think about another or an infusion, okay?
Yes, now we have again
Okay, feel the pulse. How's the pressure?
pressure is taking right now.
So, I don't know if it's still the pulse or you're I can feel the pulse. I can feel
Okay, return some kind of
Okay.
Now we have, guys,
Sorry.
we have an anticholinergic syndrome.
Yes.
We check the urine for calcium. Please, Benedetta,
Yes.
the counter if you can. Thank you.
Yes,
Yes, and also the neurologist because he's shaking. Okay, we did one lorazepam now.
Do I have a urine
sample?
You can send a urine sample, yes, he has urine.
Thank you.
Okay, his problem is ventilation. He's not smooth, but he's shaking. We have to see seizures, so we have to interrupt them.
Yeah.
Okay, so we do when it's time, so in 1 minute.
Okay, another again.
What do you
I can start with the pulse.
Okay. Then we have cardiac problems.
Yeah.
I sodium bicarbonate.
Yes.
Tim, do you agree?
Yeah.
Yes.
Okay, so I will do a 1 milli equivalent per kilogram of sodium bicarbonate low. Okay?
Cardiologist suggests to take 12 leads EKG, continuous script, send also to the
Yes,
cardiologist.
good idea. Good idea. So we remove clothes. We have hyperthermia that probably would not respond to paracetamol. We realize
Okay, so eyes near to me.
Let's go check the circulation.
Okay,
There is this kind of because if there is cardiac, we have to do the cardioversion.
I administer 20 milliequivalents of sodium bicarbonate.
How is the
Refill is about 4 seconds.
Okay, so we have the rhythm is again.
The grandfather has called into the mother's phone and he found out that the missing drug is tricyclic antidepressant.
Yeah, pulse present.
Okay, so we have intoxication with an anticholinergic syndrome. Okay, we have a malignant hyperthermia, so we are trying some physical methods to refrigerate him. We are administering benzodiazepine. Please, Vanessa, can you repeat lorazepam? Then we have to put the infusion, okay, of benzo. Then we perform 1 dose of sodium bicarbonate.
Yeah, I administer the second dose of lorazepam, 2 milligrams.
Yes. Physostigmine, yes. And I but for now, Benedetta, please, as we know how to do it, we prepare physostigmine, okay?
Yes.
And we administer it really, really slowly. You prepare also atropine because it could, we may need the antidote, okay?
Yes.
So physostigmine 0.02 milligrams per kilogram. Okay? Okay, so can you go to the mom and just say to her that we are trying to do the best and how our hypothesis, okay?
Of course. So I start with the infusion of physostigmine 0.2 milligrams per kg. Okay.
Yes, really, really slow.
Yeah.
Janice?
Yeah, your left kind of check this. You feel the pain.
I can check the pupils. How are the pupils?
The pupils are large
Okay.
and they are minimally reactive, about 1 millimeter, 7 millimeters.
Okay, okay, that's because maybe because of benzo. Okay, so don't worry.
I start also physiological
Okay,
and you have the
Central ball is the present.
Okay, right?
The nurse wants to know if we're going to give any medications for the large complex tachycardia.
Yes, okay, it's not stable, so we have to do cardioversion, so if it's still there, we have to perform an electrical cardioversion because of the refill time. Okay, so please Vanessa charge. And maybe
Oh, but she notices that it went back into the narrow rhythm, but she wants to know, should we be giving something else for the, because it goes back and forth.
yes.
We administer sodium carbonate?
Yes, that's for the larger fluorescence.
Okay.
Okay, we can perform it again, but we have to wait 10 minutes. Okay.
Other activities? Another anti-arrhythmic drug?
I was thinking about propiamide, but I think that the antidote is sodium bicarbonate and physostigmine, okay? But it is not stable. We have to do cardioversion, okay? So,
Right now, he has.
Okay, let's time out there. And now what I would like you to do is to give an S bar first. And in this case, it's an S bar to the ICU. Okay, and Janice, are you okay to be the receiver? And in case they need it, you help her back to back so that you can't see each other. So stand back to back. So now, okay, call the ICU. Okay.
Hi,
30 seconds. 30 seconds. Okay.
Hi, it's Dr. Tyson. How can I help?
Can we start?
Yes. Now.
We have a 6-year-old boy with pre-cyclic intoxication with a ventricular tachycardia with pulse that comes and went away. He was hyperthermic, so we tried to cool him down. He was shaking, so we performed 2 doses of lorazepam. We prepared the infusion. Because of the intoxication of pre-cyclics, we performed initially sodium bicarbonate because of the heart problems, and then we start physostigmine really slowly. We alerted also the CAD.
Time out. Any questions from the ICU?
Any questions for the ICU? The stop the stagers, please. Hemodynamic monitoring and airway support.
Okay, sorry, can you tell me how the patient is looking right now?
Okay, he's confused and he's shaking.
Still seizing?
Yeah.
Okay. And what are his hemodynamics?
He had a prolonged refill time, so he's not stable.
Okay. What is his blood pressure, respiratory rate, and oxygen saturation?
Saturation now with ventilation was okay, 96%. Blood pressure, I didn't, 80 on 63, 39, so it's hypotensive. And the respiratory rate is 40.
Okay, thank you. We have space for him in the ICU. We'll bring him up in a few minutes.
Okay.
Okay.
Thank you.
And then before we finish, is there any one thing you would do differently? Take 1 minute, talk together, and think of one thing you might want to do differently. Okay?
Che tipo di
20 seconds. 20 seconds. Okay. There doesn't have to be anything you would do different. Just in case you want to do something different, you can say we would like to do it. It's not because of anything specific. We're not looking for anything.
I really didn't know if a pharmacological cardioversion was appropriate, so we had to call back the cardiologist and specifically ask that, because I thought of sodium bicarbonate because it could help, but it's not the...
Yeah, I think the issue of whether to continue going with the VTAC and the the rapid changes, whether to give another medication, whether to electrically cardioverter is really a judgment decision that's difficult.
Yeah.
And so I don't think there's a right answer. I think really you were grappling with the things we would normally be grappling with. Okay. Great. Thank you very much.
Thank you.
While we talk. So Mama is here, and she brought her son Matteo in, 6 years old, because he was at his grandfather's house, and he was doing fine, but suddenly he became very confused, and he was behaving very strangely, combative, and so she came and picked him up and brought him here. He's a little bit pale, he's very confused, and so she wants to know what's going on. Why is my son acting like this? Yes.
Do you have information about age and weight?
6 years old. I'm not sure if he's this weight, and Mama's here.
It's okay, it's okay.
Guys, let's put on gloves and let's start with the evaluation.
Okay, it's okay. They're trying to help you. They want to help you.
What are you looking at? He's pale, he's combative, he doesn't want you to touch him.
Okay, it's okay.
He's asking you some crazy things, like who's in the room, why is the room blinking on and off.
Okay, what I see in his mouth, foreign body,
Nothing is
secretion.
very dry, and but nothing blocking his airway.
Okay, in A, nothing to say, and is confused.
Okay. We put him in a comfort position, let the mother be there and comfort the child. Okay, Mom?
Okay. Just expansion must be lateral. Okay. Why is he so red?
He doesn't like, he's trying to push away the stethoscope and kind of going like this.
It's okay. Why is he so red?
He looks
fighting.
He's fighting a little bit. His mother says he looks flush and feels a little warm.
Warm. Okay. So, Attilo, since he's monitoring, can you look at the monitor and tell me if there's anything wrong? And Mom, if you can comfort him, and then we will ask you things about him to help him. Okay? We'll try our best.
Okay, so in B is apnoic, normal chest sounds, and normal expressions. Okay, situation is 100% in B.
Okay.
He's still moving around and thrashing around.
Time out. Let's put on the pads. So we see it has done a small round of ventricular tachycardia, but he's still conscious.
He asks you if he's in his home.
For
he thinks he's at his home, having a bad dream.
Okay.
Maybe it's better to take a
Let's take a best access or the exams.
I hear well the central pulse. What about the peripheral?
Put a 12 in the kitchen, please. Okay, and then call the cardiologist.
Then I feel remind you. There is a pulmonology.
No liver, and the peripheral pulse is present.
There are distension of the
Sorry, I need to take the medicine. I tried to place a venous access peripherally. That's good job. Okay, if I flush with some normal thing, I take a blood gas and then creatinine, uremia, transaminase, creatinine kinase. Do you think anything else? It's okay for the moment.
You might need more blood if you're going to send out.
Okay, so you see there are no real signs. He's tachycardic and the blood pressure was a
To the lab.
low.
Yeah, it goes to the lab.
Blood
And
pressure
if you
is
want,
a
if
bit
you
low.
prefer to speak in Italian, it's okay.
80 and 40.
Okay, so guys, we have a rhythm, alteration, tachycardia, so tachyarrhythmia with the small runs of ventricular tachycardia. We are set up for a cardioversion if we need to. We have called the cardiologist. That's
No,
you?
I have to.
Okay, can you call the cardiologist?
I have to ask what.
If the rhythm.
He's shaking. What's wrong with him? He's shaking.
His eyes are deviated to the right. His jaw is very stiff,
Cardiovascular.
and he's rhythmically shaking.
Okay, I'm just going to start a timer, okay?
Matteo, can you check the monitor for me?
Yes.
Can I put together? If she is tolerating together?
No, he's shaking.
His jaw is very stiff.
In italiano?
Ok, aiutami a mettere i piedi
His jaw is very stiff.
Quindi let's put together on.
I put 100 percent of oxygen given.
Doesn't tolerate. Okay. Don't worry about the monitor. I will check the monitor for you guys. So keep on doing what you're doing.
Laboratory studies have come back. Glycemia, sodium 120. Sodium, the electrolytes, sodium 140. Electrolytes are
Sodium is 140, just
yes. Okay. Potassium is 5.0. Fluoride is 98. Bicarbonate is 15. The pH is 7.4. CO2 35.
Any medication? Yes, any fast medical history?
Yes, these are very big and reactive, like 7 millimeters to 5 millimeters, both sides.
What kind of symptoms
The grandmother has called into the mother and is missing a bottle of tricyclic antidepressant.
Yes. Okay, has depression.
So, guys,
diabetes and depression. Listen to me, okay? Someone that's
He's with the hands. Okay. I don't think so. Just we need to know the dose, when he doses.
but then
Yes, okay. I need an anesthesiologist.
can you give a sense to see if there's anything we can do right away? We have drugs to give. The boy is stable, even if he's hypertensive and we have intoxication. So we have time to do one thing at a time. Nothing to worry.
Allora, non era presente la nonno, è stato la prima le vende sui assassini al due.
We need
Okay, we need to call the antivenomous center for the intoxication.
Yes.
He's still seizing, okay?
Yeah.
So, how much time is it past? 3 minutes. So, we wait for midazolam to stop the seizure. Let's go call cab.
I haven't prepared.
I want Roberta to
I
call the
can call-
antivenomous center.
Yes.
Okay, I prepared the midazolam.
Perfect.
Okay.
So, call the midazolam.
So the way it works.
Mom, wait. Last doctor's appointment. 20 kilos. 20 kilos.
So 20 kilos.
E c'è un trisma, perché se c'è un
We're not going to go with the carbon. If you can put a nasogastric tube.
Can I put orogastric?
Just look at the monitor.
Can I put orogastric sonda?
Matteo, here I have the midazolam, it's 1 milligram to 5 millimeters. Okay. His dose is 3 milligrams. Well, 3 millimeters. I
The nurse notices that he's going in and out of a wide complex and wants to know if he should have some medication to prevent him from going back and forth.
Yeah, right now we're gonna go with the hexaton dose, 10 ml kilo, NaCl 0.9%, and to see if we can help with the rhythm problem.
Does it still work? The Venezuelan?
Yes, I think it's working very well.
It's an African ruminant, and then I start about Mateo, like film me like 10 milliliter kilos, 12 milliliter ring lactate in 10 minutes. Okay, I start
Yes, and I will tell you later about something
Exactly.
else.
Starting right now, okay?
Okay, since
We
it's still
also have the
season, let's go with the midazolam. Okay, so stop the first.
Okay.
If that doesn't work, we're gonna think about second line drugs. Okay.
I would do guys, I feel I want to do.
So you search for that.
We have to know like the midazolam in 3 minutes. Okay.
3 milligrams. That's
0.15. Okay. I'm just going to do 3 milligrams of
Let's go with that and
midazolam
take
done.
money.
Okay.
Take the time.
Done.
What medications have been given so far?
Started a bolus with 10 ml kilo of isotonic fluid and midazolam right now.
Thank you.
Okay. Yes, guys, do have a recap. So, probable tricyclic antidepressant intoxication. He's going in and out of ventricular tachycardia runs, but right now we don't have medications to do that. We are waiting for the cardiologist and anesthesiologist. We have given bolus and midazolam to stop the seizing. He's still seizing, so we'll see if we have something else to do about the convulsions.
Rob suggested us to administer sale di carbonato ma che velocemente ed eventualmente da veloce in vena di aggiornarlo e con la linea per fermare la convulsione mi ha iniziato un
If you have problems with communication in Italian, you can ask this.
Yeah, very good.
For the second drug.
The second drug. Let's go with the bicarb. The bicarb 1 liter kilo.
Okay, let's stop there. Okay? Okay, good. Now we're going to have an S-bar to the ICU. Janice, turn around so you can see each other.
Yeah.
And you're going to call it.
Scan.
You can turn around this way and call the.
Okay.
Okay, and now we're going to have a 30-second S-bar to the ICU to ask for the bed and what you need, whatever you need.
Hi, it's Dr. Tyson from the ICU. How can I help?
Hello, so we have epileptic status in still seizing in a patient with a probable tricyclic antidepressant intoxication. He's 6 years old, we don't have a weight, but we were with 20 kilograms. We've administered a first dose of midazolam and a bolus isotonic fluid is ongoing. We have called the CAF and we are administering bicarbs right now on a suggestion by the Anti-Poisonous Center, and we need you to stabilize the airway, monitor the cerebrovascular system, and keep him stable.
Time. Okay, ICU, do you have any questions for the...
Yeah, how does he look right now?
He's seizing, before he was seizing,
he's
still seizing. He's in a lateral position for airway protection and receiving 100% oxygen via mask, and has the pads on with a IV line on the upper arm. And is monitored and going in and out of ventricular tachycardia runs.
What is his oxygen saturation, his respiratory rate, and his blood pressure?
Okay, so the saturation was about 88% with 100% oxygenation going. Heart rate was about 150 BPM, and it was hypotensive with 80 of over 40, around or 30 of blood pressure.
Okay, we're preparing a bed. I'll come right down.
Okay, thank you.
Okay, one more moment. So, take 1 minute and think if there's anything that you would like to have done differently, like to correct, would like to do differently. Maybe nothing. I'm not saying there's anything to correct. I'm just think, and then if you want, you can tell us what you do. Okay? I'll give you 1 minute from now.
Una pausa. C'è la pausa quando ho iniziato a convulsionare, ci stiamo aspettando tutti i rush. Forse per fare una pausa, c'è chi ci sta, non devi essere neanche per convulsionare.
About 15 more seconds. 15 more seconds. Okay. Okay. Anything you want to change? Nothing.
So we were all with a high burden, high intellectual burden, many things to do all at once.
Yes.
It was a very complex situation. So what we could have done better, maybe to have a recap, to prioritize things to do and assign them in a more structured manner to each of the member of the team, because sometimes we were overlapping, so that wasn't done properly.
Yeah, I think this is a really difficult case because you have some arrhythmias that probably need to be treated. You have seizures and altered mental status that needs to be treated, airway that needs to be supported, and the prioritization is very difficult. And the treatment, you know, to get through the usual seizure medications and then go to the toxicologic treatment is difficult. So great job. You guys did very well.